some people will think it's too good to be true, can't happen. And
Well,
is
I
there
can
anything
guarantee you it can, because I was the same way. I'm like, is this really going to work? I want something that's going to work. And I was amazed. I mean, it was like unbelievable. And I have faith, and you're amazing. What you did, it's your technique, and doctors don't use that sort of technique. And I told my family doctor, I said, all you do is practice medicine, and you get drugs from the pharmaceutical companies that come in and give you, big luncheons and everything else. And he said, you're absolutely right.
Mm.
He agreed. But you are different. I mean, you are amazing in helping me overcome what was wrong with me.
It's only going to get better. Remember, I said that. This is
Yes.
only part of the way. This is only part of the journey. And it's soon, all of these pains are going to be gone and the emotional state's going to be a lot better. Hi, I'm Dr. Herman. I am speaking with one of our wonderful patients. This is Barbara. She comes to my clinic in South Florida from up northeastern part of the United States. And one of the reasons is because of intense physical pain due to rheumatoid arthritis, diagnosed by a rheumatologist, as well as a serious emotional stress, a serious emotional problem that she's been dealing with for quite some time. So we're just going to get right in and ask her some questions. And the reason why we're doing this call right now is because the incredible results she's had from working with me, the results that she's had from no other physician, only from what we provided her, which is just phenomenal. So Barbara, if you could tell us, how long ago were you diagnosed with RA?
Back in 2018.
2018. And it was a rheumatologist who diagnosed you?
Well, I had a bone scan.
Okay.
And then my family doctor called me and told me I was going to hear from a rheumatologist. And then they called me. There's only 2 in the area where I live. And she notified me and set up a meeting or an appointment. And she told me that, it's really bad. She gave me shots, did no good. And she said,
Was that the Humira? Is that the shot?
I don't even know what she gave me. One in the shoulder, in my fingers, in my hands, my wrist. And they did no good. And she said she couldn't keep doing it. So she put me on strong medication, and there were so many side effects. And I told her, I sent it in the protocol or in the portal. I said, I can't keep taking this because I couldn't breathe. I was losing hair. I lost a lot of weight. And then she said, well, I'm going to call in another one. So she called in another one. It was the same situation. It wasn't doing any good. And I was so frustrated because I couldn't do anything. So I sent her another, message. And I told her, and I said, and you don't even know my medical history. I said, this medicine, I can't breathe. I said, I had 8 collapsed lungs and 1 repaired. And I said, it is, really playing havoc on me. So she goes, stop it right away. So I did. And then that's when I typed in what causes RA, because I went back 3 generations and nobody in my family has ever had RA. And you came up and said what causes it and why drugs don't work. And every drug you mentioned was every drug that she put me on. I mean, they were some heavy duty drugs. So, I just got tired of it. And that's when I called the office, and I was a mess. I cried like the whole time. I said, I'm sorry. I said, I can't. So anyway, then she called me back, and then I returned her call and set up an appointment.
Mm-hmm. Your pain with, and we're glad that you were able to get in here and start getting better. So your pain was throughout your whole body?
Yeah. I mean, it was attacking like different parts of my body. And, it was just a mess. The medicine was terrible.
Did the medicine make it worse or just make no difference?
Well, it made no difference, but the side effects is what really, got to me. And I couldn't take it no more. And then she changed it again. And it was the same ordeal. I mean, my hair has thinned out. It falls out. It was just a mess. And when I came to see you and I got the remedies, and I went off of the medicine completely, all but my Adderall, because I'm kind of still scattered.
Mm-hmm. Well, we're not done. You're not done with the protocol. Right now, just so you all know, she's about 3 weeks into a pretty lengthy protocol to help her remove the different infections and toxins I found in various tissues of her body that caused the RA, as well as something else that we'll be getting into in just a moment. But in 3 weeks, the reduction in the pain is dramatic. And that's one reason we're on this call with her right now. And I'm glad you're so generous with your time to share this with everybody. your pain on a scale prior to coming to me, your pain on a scale of 0 to 10, excuse me, your pain on a scale of 0 to 10 prior to coming to me, if 10 was the worst pain you can experience in your book, what level would you say your pain was at before you ever came here?
10. I mean, it was like
Okay.
off the chart.
Off the charts. And was that, I'm
Instead of
sorry?
10.
A
It was
10.
at like off the chart. And you know what? It brought me to tears.
On with that 10 level, was that constant for you? Was that day and night, or was that only for part of the day, but it would fluctuate and become less at certain times?
It was very, I mean, it was basically most of the time
Mhm. Mhm.
because I couldn't do anything. It's like when it came to open bottles, you know, anything. I couldn't do it because my wrists hurt so bad. My hand, the tops of my hand, I couldn't even stand fabric touching the tops of my hands.
Hmm.
It hurt so bad. And it's like, why does the fabric touching the top of my hand hurt so bad? But it did. And people, you know, I mean, I couldn't help it. I cried with pain.
Now that you spoke with my assistant, I know she made contact with you on about your week 2 or 3 of this first protocol that you're following from me.
Where'd you go?
That's okay. So now that we're on, you and my assistant made contact about week 2 or 3 on my protocol, on the
Yeah.
protocol that you're following from me. You had said that you felt so much better already. How much reduction in the pain? If 10 was the worst, and that's where it was almost constant, how much reduction are you experiencing now? If you can give a percentage, is it like 50%, 70, 80?
I would say, you know, 50%. It's like
50.
hair. It fluctuates. It depends what I do.
Mhm.
If that makes sense. Like
Okay.
I guess I aggravate it. I don't know.
When you don't aggravate it, when it's not, so 50% reduction, is that maybe the worst that it gets now? Is that what you're
Yeah.
saying?
Yeah.
And
Yes.
how
And
much when it's
when
even reduced more
I
than
don't,
that? I'm
right.
sorry?
If I don't do anything, I don't have anything.
You don't even have the pain. But before, if you didn't do anything, like
Oh, it was still there.
it was still there at a
Yeah.
level maybe close to a 10 if you didn't do anything, like doing a chore around the house
Before I came to you.
before you came to me. Yeah,
Yes. Yes. Like I said, it was off the chart.
it
It
was
didn't
off the
matter.
chart. It
And
didn't matter. So now when you don't do something, it could be not even there, the pain.
right,
You feel
exactly. If
good.
I do something and I understand, you know, I'm going to get it. It's not going to be gone completely, but it's so much better.
Yeah.
Like,
Awesome.
yeah, I mean, I was ironing like yesterday and, you know, I can feel it, but it's nothing like it was. And I know people thought I was like just crying for no reason because I mean, it didn't matter who I was with. It was that bad.
Yeah. When you also told me that you had a shortness of breath that was
Yeah.
happening. That was pretty common for you just to walk downstairs or to
Yep.
do some other chores around the house. Is that still happening or is that totally gone?
I would say it's basically totally gone. I mean,
Totally
I can,
gone.
because before I couldn't, I mean, if I go down to do laundry, you know, I was huffing and puffing. It was ridiculous. I could
And now
not breathe.
and now it's
Mowing the
gone.
grass. I couldn't even mow my grass. I couldn't even vacuum my pool.
And now that's all gone.
Well, I didn't open my in-ground pool yet because I'm still in Florida, but
Okay. But
you know,
but
it probably
you
will be.
wait, but you can go downstairs. You told me you're not
Yep.
short of breath anymore.
Nope.
You can do other chores around and you're not short of breath anymore.
Exactly.
Yeah.
Exactly.
So
I mean, I
with this,
couldn't breathe.
yeah, with this part, beside we're going to talk about one more topic in just a moment. But with this part of the reduction in the pain and the ability to breathe better, or people around you who know you, who've known you prior to coming here, are they noticing the difference in you?
Yeah, they know.
Mhm.
And like, I don't know if I told you, but like I have a relative who's a doctor and another one is a pharmacist and the rest of them are RNs. And they go, what's he going to do? They saw me. They even wanted to know the meds that I was on and they're telling me how to breathe because I couldn't breathe. And this was when we had a family gathering for Christmas. And it's like, I could not breathe. And I went down to the family room to get, you know, stuff and carry it up. And it was like, I was out of breath.
Hmm. And
And
so what do they say now?
well, I haven't seen them because I haven't really been back up north. And now, I mean, it's totally different. When I did go back up for a short period of time, I could go down to my laundry room, do laundry. I mean, I was fine.
Incredible.
But before it was unreal.
You couldn't even, you told me when I first took notes with you that you couldn't even blow dry your own hair because the wrist pain, the arm pain was, and the hand pain was so bad.
Yep. And I don't know if I told you, but I mean, I had hair salons and that's what I did as a profession, along with working for Medicare insurance. And I couldn't do hair. I mean, it was the point where I couldn't even do my own hair, let alone somebody else's, because of the wrist movement when you're blowing dry in hair, or if you're using a curling iron, the wrist movement I couldn't do because it was so painful.
And now you can move the hand and the wrist and the arm in that way.
Yes, I even ordered rollers, okay, from Amazon, thinking that would, let me do my hair, but it didn't, because there's wrist movement when you're like blow drying or, curling. I couldn't do it. I mean, it's crazy.
But now,
Now, yeah, I can.
yeah.
And it's like I said, I'm not going to live my life the way I was before.
Mhm.
And people think I'm crazy because I said, I'm going to come down to Florida and I'm going to come see you. And they're like, you're crazy, what's he going to do? I said, well, he's going to cure me. And I have spoke to my relatives up there already. And they wanted to know how it was going. And I said, it's going great. I said, my pain has subsided so much. It's unbelievable. I mean, it's amazing. It's totally amazing. You're amazing what you did.
Thank you. My
You're
pleasure
welcome.
to do this with you and for you. You appear a bit stronger now, emotionally as well, speaking right now. I remember when we first spoke about your condition going back, that was back in November of 21 when we first talked. And right now it's April 19th of 2022. So we're only talking maybe 4 months since I saw you. You were breaking down, seriously, crying a lot. Emotionally, you had become pretty unstable, because of the pain that you had been in for so long that medicine wasn't helping and doctors couldn't figure out why, but also B, you had lost somebody very close to you. I don't know if I can share how personal that is, but
Yeah, you can.
you lost your daughter,
Yeah.
and without getting into all the details, it's been very crushing for you, and she is who you cherish so much, and not really knowing what happened with her, and so that left you with many sleepless nights and many just very sad and depressed and crying all the time. Is that a
Yeah.
fair with that? Since you started taking these energized formulas that you're taking from us, that we provided you to help you rid what I believe are different infections and toxins get deeply embedded in the brain that keep people stuck in a certain emotional state. And we did a very lengthy emotional workup with you in the exam room, if you remember that.
Yes, I do.
Right now, since you're not even crying speaking with me, which is wonderful, because the first phone call, it was crying all the time. The first visit here was crying all the time. How much reduction if it's fair to say depressed, is that a fair way to put that? Or would you phrase it another way, what you were experiencing prior to coming here?
Well, it was depression.
How much
Yeah,
reduction? I'm
a
sorry.
lot. I mean, I don't, sit around and just think what happened. And that's what I used to do. I would just try to, figure out what could have happened, because I don't know.
Mhm.
And that was the hardest part. And to this day, I still don't know. I mean, I have my moments, but nothing like I did before. I don't dwell on it. Okay. I guess that would be a better word.
Right.
But even when I was still working after this happened, I would just constantly dwell on it. It's like, what could have taken place? They put me out on short term a couple of times.
Since you
But
started, I'm
go
sorry,
ahead.
you go.
But I mean, that it eventually came to the fact where they had to let me go because I just couldn't function. I was bad.
Yeah. So since your daughter had passed, it was really hard for you to sleep, hard for you to think or do anything else because you've been and respectively understood that you miss her and you don't really know what happened to her. You have a feeling of what happened to her. We don't have to get into that detail right now, but your daughter was taken from you, and You had been sad all the time, crying all the time, not sleeping at night. Every thought in your mind all day and all night pretty much was you want to
Yeah.
handle the situation for her. You want, you want to know what happened. And so that was a constant. You've been, if we can say, and I don't mean this in any disrespectful way, but stuck in a cycle of just not breaking free of that whole torment that you've gone through for a pretty long time about what happened with your daughter. That's fair to say, right?
Yeah, it
Crying
is.
all the time and just stuck in that pattern.
Yeah,
So
just trying to
now,
figure out myself, and what I could do. How could I find out? Because everybody has lied to me,
Mhm.
and there was so much corruption.
But right now, you're at a point of how much reduction in that cycle, in that emotional experience, and in feeling better or coming out of that. How much better would you say you feel? If you can give a percentage, if there's a way to quantify that.
I would say half. I
Half.
mean, I don't wake up in the middle of the night. I mean, I would fall asleep and then I just like wake up and it was like I couldn't get back to sleep because all I did was focus on what could have taken place. Why was this, covered up? Why, was there so many lies? And it was practically my life.
How long had you been stuck in this emotional state for depression and crying and constantly thinking about it? How long has it been?
Oh, since it happened.
How long,
I was in my bedroom
how
for
long,
over
what year was that?
2016.
2016. So
Mhm.
about 5 years up until the time that we met and you started on this care plan with me. For about 5 years, you've been stuck in a serious, depressed, emotionally unstable, crying all the time state. That's a pretty fair.
Yeah, I was on a lot of medicine. I had to see a therapist or psychiatrist or whatever, and
Mhm.
it was bad. I mean, I spent 2.5 years in my bedroom. I wouldn't leave. I wouldn't go nowhere. But my daughter would make me come out there over the holidays because she didn't want me alone. But I mean, I'm not like that anymore.
You feel a
It
lot
has gotten
better.
better, and I don't sit around and dwell. I just I wish I knew
We
what happened.
understand. So it's to be able to find out what really give you closure to your daughter not being with us anymore, not being here with you.
Yeah, because I don't have closure, and people don't understand that. A lot of them know what happened to their,
Yeah.
children. I don't, and I don't know. Some people understand and some people don't understand. It's difficult. And I'll tell you, losing a child isn't anything like losing your parents because you don't expect to bury your child before you.
We're sorry that happened. But at least
Uh,
it's become easier for you to think about her and think about what happened. I know you're getting emotional right now, but this is because we're focused on this topic and discussing it.
Yeah.
But all the time prior to these past few weeks of following this protocol that we customized for you from our first visit together, your whole emotional state has gotten better. You feel a
It
bit more
ha-
comfortable. You're not crying so much. You're not lost.
yeah, it has gotten better. I mean, I was emotional like when the anniversary date came up, which was the end of March 29th. And I'm not a big Facebook person, but I do post on Facebook the day that she was taken and her birthday.
Mhm.
But I don't wake up in the middle of the night and just think, what happened? What can I do to find out? All that stuff.
Does it just feel like something lifted from you? Some of the pain is lifted?
Somewhat, yeah. I mean, life goes on, is what I'm always told. And it has gotten better. Like I said, I don't wake up in the middle of the night and just lay there and think what could have possibly happened. Because the toxicologist said there were no drugs found in her system. My friend who said that her husband and her thought that she was smothered with a pillow by her boyfriend, but I don't know.
So
There were
there's
no.
suspicion that she was, I don't want to even
Yeah,
say the
they
word, but
lied on the death certificate. They said,
her life
"Oh,
was taken by somebody she was involved with for a few years. So
yeah,
proof of it.
yeah,
But that's the thought. So that's left you distraught for several years and it's horrible. And
yeah." And then he committed suicide.
and then he committed suicide. But so it's all horrible. But at this point, with all the psychiatry and the therapist and the medications, everything we tried, that never was able to make a dent at all in
Oh,
helping you feel better or cope with your days. Right now, it's about 50% better. You're able to function. You feel like some of that negativity is lifted, even though you still want her back and you still would love to have closure. That I understand. But at least at this point, you're able to function in life without just stuck in that pattern. That's a fair statement, right?
yeah. I mean, I was on all kinds of meds. I was like a zombie because I was so bad, I
And
guess.
now the medications you stopped and you're feeling better emotionally and physically. Yeah.
Yep. Yeah, from my family doctor and
Mhm.
the therapist. Yes.
Mhm.
I'm not really on any of them. I'm on the generic Adderall because I'm scattered.
Well, that will be over soon too. That's going to be over soon too. As we clean you up, that will no longer happen. So we still have some other symptoms that you're going to be relieved of in your first protocol. Again, this protocol is 100 days. So you've got a lot of cleanup to do. 100 days is more than 3 months. You're only in week 3 right now of 3 months. So you haven't even completed the first 4 weeks of a 16-week program. Okay. So everybody who's listening to this can happen rapidly for you as well, with reduction of pain, with breathing better like she has, as well as we can really help you break free from some of the emotional torment, whether it's depression or anxiety, to help you overcome certain, let's just say there are certain things in your body and your brain that are blocking you from moving beyond some of these emotional states that people have gotten into. So we'll talk about this and what I provided her so far in another video that we're going to switch to in just a moment. But right now, I'm so grateful that you have gotten on this call with us. I know yesterday when we spoke, you had all this emotion of how amazed you are. Right now, you're
Right.
being reserved with us. So I'm going to ask you, because I didn't get to record that conversation we had yesterday where you really gave me everything from your heart. So I'm just wondering if you have anything else to say to anybody who's listening to this, if there's anything that you can express to them to help them understand what really, the impact that this has had on your life, coming here and figuring it out finally, and what, if some people will think it's too good to be true, can't happen. And
Well,
is
I
there
can
anything
guarantee
else you
you
can share?
it can because I was the same way. I'm like, is this really going to work? I want something that's going to work. And I was amazed. I mean, it was like unbelievable. And I have faith. And you're amazing. What you did, it's your technique. And doctors don't use that sort of technique. And I told my family doctor, I said, all you do is practice medicine and you get drugs from, the pharmaceutical companies that come in and give you, big luncheons and everything else. And he said, you're absolutely right.
Mm.
He agreed. But you are different. I mean, you are amazing in helping me overcome what was wrong with me.
It's only going to get better. Remember, I said that. This is
Yes.
only part of the way. This is only part of the journey. And it's soon, all of these pains are going to be gone and the emotional state's going to be a lot better. And you'll be off the Adderall. Your brain won't be scattered anymore. So we still have more work to do. We don't even know the end of the results from what we've prepared for you in this first protocol. You're only not even a third of the way through this. So I look forward to hearing how you're going to respond in the next 2/3 of this protocol. And when we can see you again, maybe check back in with another video to let people know how much more improvement you've experienced. And then again, as I told you, you're going to become a lot more stable. The Adderall is not going to be needed. You're not going to be scattered. Your brain is going to be clear, and all this pain from the RA is just going to disappear. We've done it for other people. You're having it done for yourself now, and you will achieve what you're coming here for. That's 100%. Okay.
Oh, I believe you. Yeah. And anybody else that is having, problems with their health, you're the guy to see. I
Thank you.
guarantee it.
Thank you. I appreciate that. All right. That's all that we needed for now. I'm going to stop the recording, let you go on
Oh,
your way. I thank you so much.
you're
And
welcome.
look for this online in the next couple of weeks.
Okay.
All right.
Thank you.
You're welcome. My pleasure. I love it. Love you.
Thank you.
Bye bye.
Bye bye.